Namaste, everyone. Welcome to our weekly PBA channel where we talk Ayurveda and provide everyday solutions to our listeners. And the solutions are most of the time very efficient and budget friendly. So today we are talking about keto diet, and I'm here with Dr. Siddharth. Dr. Siddharth, can you please introduce yourself?
Namaste, very warm good afternoon, Karolina.
Good afternoon.
I'm
Good
Dr.
morning.
Siddharth. Fine, there is good morning. Fine, fine. So this is Dr. Siddharth PA, and I'm basically from India. I'm a certified Ayurvedic practitioner, and I have finished my graduation in BAMS, that is Bachelor of Ayurvedic Medicine and Surgery, which spans for about 5.5 years. And since the completion of my graduation, I started practicing Ayurveda for the past 5 years. And
Oh,
I'm quite focused, yeah, and interested in treating lifestyle and metabolic disorders, which is very prevalent nowadays, like obesity, diabetes mellitus. And I'm quite skilled in doing panchakarma, and I'm also pursuing a master degree in clinical nutrition and dietetics.
so
So this
you're
is a
actually
short
very
introduction about me.
qualified to be talking about today's topic, right? Everybody talks about keto diet. I am on keto diet. I lost 10 pounds, 5 kilos. So what is really keto diet?
See, basically, what the problem is that people are aware of keto diet, but nobody knows how to practice keto diet and for how much days, for how long it should be practiced, and what are the
Exactly.
possible health benefits of keto diet. So saying is different, and practicing is different. So always I prefer keto diet should be practiced only after an expert's consultation, or if an expert is advising about a keto diet to a specific patient, then only they should practice it. It should not be practiced on its own. So basically, the definition or concept of keto diet is nothing but it is a form of nutritional ketosis. That is a scientific term which we, depict for ketogenesis or keto diet. So it is a type of therapeutic dietary intervention where we are going to restrict the carbohydrate intake, and we'll be moderating the consumption of proteins, and we will be increasing the calories obtained from fat. So basically what happens is the therapeutic attributes of keto diet is mainly because our body switches from the glucose metabolism to fat metabolism. So this shift from glucose to fat metabolism is having a lot of positive health benefits. That is what the entire keto therapy is actually.
I read the definition, a standard definition that normal keto diet has 70% fat, 20% protein, and 10% carbs. And what was interesting, why the proteins are also limited, not only carbohydrate. Can you answer this?
Yeah. See, when we are talking about keto diet, there are two types of keto diet basically. One is a standard keto diet, and one is therapeutic keto diet. So,
Okay.
therapeutic keto diet is mainly given in chronic and degenerative diseases, where our main focus is to cure a specific disease and to gain and to reap the complete benefits of keto diet. So, there we will be giving the calories, nearly 90% of the calories will be obtained from fat, and 5% carbohydrate, and 5% proteins. So
Wow.
therapeutic keto diet mainly focuses on all the benefits of only fat diet. So there we have to reduce the protein and carbohydrate intake to very, very minimalistic value. So that is what the main difference is. So when you go for standard keto diet, that is something different from therapeutic keto diet, where we will be making use of 75% of calories from fats, and then the another 20% is from proteins and 5% from carbohydrates. So in standard keto diet, we are not going to reap complete benefits of keto diet, keto therapy. We'll be giving a little bit of proteins, and this can be practiced for quite long period of time, but not more than 15 days. So therapeutic keto diet is
15
highly
days.
restricted. Yeah,
Okay.
15, 1 5.
Okay.
So therapeutic keto diet is practiced only up to 9 days or 10 days because it is
Mm.
completely therapeutic in nature, and our body undergoes a lot of drastic changes during those times. So it cannot be continued for a longer period of time.
Can you give me an example? For instance, if you are a vegetarian, how can you practice? Because when I think of keto diet, I think about consumption of meat or fish or animal-based fats. So if you are a vegetarian, what can you eat?
See, people always think that when it comes to fat, they always rely on animal sources like eggs,
Yes.
butter, milk. So basically, what happens is we can get the ultimate or the maximum um, that fat. What do you call that? Ketotherapy fat from
Yeah.
plants also. Even plants are also having fats in them. So if you
Sure.
go for an example, berries, specifically nuts like almonds, pista, cashew nut, all this contains fatty acids. So they also contain some 70 to 80% of fats in them, specifically, dry fruits, nuts, and even some other medicinal plants like, berries. And you know about cruciferous vegetables, if I'm not wrong.
Uh, Avocado.
Yeah, avocado. Then like, cruciferous vegetables like radish. They also contain, a lot of plant-based fatty acids. So
So
plant-based fatty
yes.
acids are different. So omega-3 fatty acids, linoleic acid, stearic acid, all these are nothing but fatty acids. So they're also nothing but fat. So every time when we think about keto diet or ketotherapy, we don't have to rely only on animal sources. But ultimately, when it comes to keto diet, you can't avoid ghee and milk, which contains, more than 90% of fat in them.
Okay, so basically for a vegetarian, this diet is this is a nut-based diet, right? Keto diet.
Nut-based and diets which contain more fibers and fatty acids in them. You can go for cruciferous vegetables, you can go for berries, and you can go for cashew nuts, as you told, avocado, and
Mm-hmm.
other fruits and vegetables which contains more fatty acids in them.
Okay, this is also going back to the theory. I read that keto diet is often used in some types of cancer. Why would that be so popular, and why would it work?
See, this is a very, very interesting topic, Karolina. You come to the question, very quickly, actually. So the thing is that, as I told you, keto diet has a lot of benefits. So the benefits of keto diet is mainly attributed because of the switching from glucose metabolism to fat metabolism. So if you talk about cancer, there are a lot of data. So
Okay.
when are talking about cancer, that is one of the prevalent diseases nowadays, and people are very much afraid. And even modern medicines fail at some point of time when the cancer reaches its last stage. So how ketotherapy can, possibly have its positive impacts on cancer is nothing but, it reduces insulin resistance, it reduces glucose levels. So once your glucose is reduced, this cancer cells starve of energy, because ultimately they also need energy for their multiplication. Cancer is nothing but, multiplication, or excess multiplication of the cells in the body. So for the excess multiplication, they also need energy. So once our body switches from glucose to fat metabolism, the cancer cells will starve out of energy. So this actually impairs their proliferation signals, and it cuts their energy, because of which the further proliferation or multiplication doesn't happen. And
Very
moreover,
interesting. Yes,
yeah,
it makes
and it
sense.
also increases the susceptibility for
Yeah.
chemo and radiotherapy, which is called as Warburg effect. So maybe you might have heard of that.
Yes.
So Warburg, a scientist, he founded the therapeutic benefits of keto diet on cancer cells. So he came to a conclusion that it cuts their energy, it impairs their proliferation signals, and thereby what happens is it decreases the insulin levels and glucose levels, and it also increases the susceptibility of cancer cells to chemo and radiotherapy. So it
Okay.
can also be, yeah.
Sure. So okay. So for cancer, thank you for explanation. This was really like to the point, and wow, very interesting. But why would it also work for the certain neurological disorders like Alzheimer's and Parkinson? That's also interesting. That's also I've read it's very popular.
Yeah. See, what happens is, as I told you, when see keto diet basically secretes three types of main chemicals in the body. Okay, so that is not secreted when our body is having glucose metabolism,
Yeah.
to be very frank. So these three chemicals are, I'm just naming it just for understanding.
Yes.
So one is acetate, one is acetoacetate, and one is beta hydroxybutyrate. So this beta hydroxybutyrate is one such antioxidant enzyme which is having numerous benefits on human body. That is one thing. Second is that, the BHB, that is beta hydroxybutyrate, and its derivatives are having protective effects on specifically on our that is neurons, brain cells. And it also improves this specific chemical, also improves the cognition and improvement, in Alzheimer's disease by increasing a specific enzyme called reduced glutathione, that is nothing but an antioxidant enzyme.
Ah.
So this BHB is the main factor, and most of the therapeutic benefits of keto diet has been attributed to beta hydroxybutyrate, this chemical, and its derivatives.
Very interesting. But this also leads us to another very important issue. We keep talking in Ayurveda and in many schools about microbiome, right? In our intestines, our guts are like a second brain to us. So in case if we eat only a nut-based diet, if we're vegetarian, or meat-based diet or fish-based diet, what happened to our microbiome in the intestines?
See, gut microbiome is a very complex ecosystem, to be very frank, because we don't know what is happening in our gut. Because a proper amount of gut microbiome should always get maintained for the entire functioning of our body. So you won't believe, Carolina, if I say, more than 8,000 species of bacteria, fungi, and virus, live in this complex ecosystem. So that is something great, isn't it? 8,000 different species. So what the studies have found that, if there is a diversity in your gut microbiome, your gut is healthy. If there is no diversity in your gut microbiome, you will get diseased. You'll be prone, you'll be susceptible to different diseases. So keto diet, what happens is it helps in the diversification of your gut microbiome. Thereby, it helps in insulin resistance, and also it also helps in, it also acts as anti-inflammatory agent, because these gut microbiome has a very significant role in, in preventing disease and in creating diseases. So that is how, basically, yeah.
This is very interesting, because I always, when I study microbiome, I always read that diversity, you need to eat very different foods, you need to adapt to the seasons, to the regions. And if you, in keto diet, you are really like a monothematic. You only either eat nuts or you eat meat or fish. So what happened to microbiome? Doesn't it starve most of the bacteria?
No, see what happens is keto diet doesn't mean that, you are only giving fat. You can also you have to restrict carbohydrate, you have to restrict protein, but at the same time, you can also give them dietary fibers. Because, fibers are also included in keto diet. This is a very important point, because that's a very good question.
Okay, so we were talking about microbiome, and I know that I am diabetic. So for me, microbiome is very important, because it's responsible in partially for insulin sensitivity. And if I, for instance, go from cold to Europe and I fly to Mexico in winter, and in Mexico you have warm weather, the microbiome changes, and when it changes, my insulin sensitivity goes down. I need to inject more. I don't feel so well. So this is one of the questions that I have regarding the keto diet for diabetics.
Yeah, very, very well told, Karuna, very well told. Because see, gut microbiome is very, very important, and you have observed its, effects on your body. Because as you're diabetic, a lot of people, they don't keenly observe what is happening inside their body, but you have anyway observed. See, the recent studies have found out that, the diversity of gut microbiome, is actually correlated with the good health. So if your gut microbiome diversity is reduced, or if you are having a specific type of bacteria called firmicutes, that is what they call it as firmicutes. They are not healthy bacteria. So once these gut diversity decreases and the increase of firmicutes happens in the body, in the microbiome, in the gut system, it is actually related with a lot of diseases like insulin resistance, metabolic disorders basically, and abdominal adiposity and inflammatory conditions. So keto diet and the diets which are prebiotic in nature.
So anyway, we had some technical difficulties today with recording. I just wanted to summarize that the keto diet is a very, very powerful tool. to lose weight, and also to control higher sugar levels in case of type 2 diabetes, but it needs to be administered wisely with using and eating a lot of green vegetables and fibers and nuts, and not only thinking that this is a passage to processed meats and bacon, because remember that processed meat, as Ayurveda says, is very harmful for you because it has no life in it. So if you eat something that has no prana, then you get no prana, and then you have no energy left, because your entire body is focused on digesting something that really is a poison. So, and please remember, subscribe to Pure Bliss Akram, and we'll follow up on the next episode of the PBA and Keto Diet, and that will be different recipes for vegetarians and also for people who from time to time eat fish or meat. All the best. Namaste. Take care, and please subscribe to our channel and see our website, pba.com. Take care. Bye.